Hello friends, do you know that men are quite vulnerable to depression and anxiety related disorders? More so because they have to juggle between multiple roles and responsibilities, not just towards the family of origin, which means their parents, their brothers and sisters, but also trying to balance it with the family of procreation, which is their wife and their children. They also have to prove themselves in the world in terms of their career and also strike a balance between work and their family life. Given all these stresses in their mind, they are quite vulnerable to depressive disorders, to at times significant anxiety, to avoidance behaviors at times, and to substance use disorders. These are all treatable. It's high time that we understand that suffering from depression or anxiety does not mean that a person is mentally weak, or the person, if at all is a male, cannot have depression or anxiety. These are very common and they need appropriate, timely interventions, help, understanding, and care. We're also seeing a lot of marital discord coming up in men these days, particularly when it comes to interpersonal relationship between them and their partner. There are many myths associated with men suffering from psychiatric disorders. People at times feel that a man cannot cry, a man cannot feel depressed, a man needs to get into some or the other form of substance use to prove his manliness. These are all forms of myths. It's important to understand that if a person is suffering from substance use disorders, be it alcohol, be it smoking, these need treatment because they are ultimately detrimental both to the physical as well as the mental health, and there are appropriate treatments available for the same. 2. Man can also cry, man also needs to ventilate, and man also can go through depression and anxiety related disorders which are absolutely treatable. They need to be identified in time and rectified in time. It's important to understand that man is also a human being with emotions, and it's very important not to see man only as a provider but also as a person who needs equal compassion and care and concern from his near ones.